Patients, not profits. Patients, not profits. Patients, not profits.
I have been through the whole gamut of emotions. Last week there was a day where I was just angry when I saw the rhetoric that would go out into the media, or the rhetoric that was being sent to the nurses, and how we were made to feel insignificant. Then the next day I was teary-eyed and upset because I was concerned about leaving my patients to other staff that didn't know the Minnesota standards that we have, and also leaving behind other workers that have had my back and I've had their back, and knowing that they're going to do everything they can to take care of them. And then just sad that we're out here on this to have to stand up for ourselves. But we're looking for safe patient ratios, we're looking to prevent workplace violence and have good safeguards in place, and we're looking to take care of our nurses. Nurses are the checks and balance. Healthcare has now become a business, and the nurses are the ones that keep the human inside of that business. It seems that patients come in and they take out, sometimes they can't help it because of a medical issue, and they become violent and they strike out, or they spit at us, or they punch us. Or when I was pregnant, I got kicked in the stomach when I was 8 months pregnant. And we always say, oh, it's okay, we try to take care of the patients, but we also need to have strong language that supports the nurses so that we can protect and take care of ourselves when this does happen. Over the years, the nurses have maintained a certain benefit package, or what we call a total compensation package. And sometimes that means that we've negotiated a 0% raise over a year to maintain the health benefits that we have. Alina is currently making good profits and one of the leaders in the industry in the Minnesota area, yet they want to take away part of this benefit package that we've negotiated. So essentially that's a pay cut to the nurses. I've got a son with special needs, and what this could mean is, where I've worked at a facility for 20 years, I may have to give up the clinic that my son has gone to and the provider that's cared for him for 14 years just to switch to their plan. I've purposely chosen a plan that would continue to protect us in the way that I need to. The other plans may be okay. Again, the issue isn't that the plans are bad, but there's a standard that we've established, and because we've established that standard, the nurses are protected. If we switch to these other plans, we lose all protection and say as to what's going on in our healthcare. They will be able to change it at any point. And the other thing is they talk about how their plans are, everybody's on these core plans, but yet each organization has a different description as to what that core plan is. So if they talk about the Alina First, what one person pays at Abbott may be different from what a nurse pays at West Health. And so to say they're all the same plans is not a complete truth.